Welcome to our deep dive into phacomatoses, also known as neurocutaneous syndromes. These genetic disorders affect both the nervous system and the skin, leading to a variety of clinical manifestations. And we're going to break down these complex conditions into understandable terms, exploring their causes, symptoms, and available treatments. Whether you're a patient, a family member, or just someone who wants to learn more, this video is for you. We'll cover 6 main types of phacomatoses, giving you a comprehensive overview of these unique disorders. Let's start with neurofibromatosis, often shortened to NF. This condition is not just a single disorder, but a group of genetic disorders that can have a significant impact on a person's life. NF is actually a group of genetic disorders that can cause tumors to grow on nerves. These tumors can appear anywhere in the nervous system, including the brain, spinal cord, and nerves. Now, there are 2 main types, NF1 and NF2. Each type has its own unique set of symptoms and complications, making it crucial to understand the differences between them. NF1, sometimes called von Recklinghausen disease, is the more common type. It affects approximately 1 in 3,000 people worldwide. People with NF1 often have café au lait spots, which are flat brown birthmarks. These spots are usually present at birth or appear during early childhood. They can also develop neurofibromas, which are benign tumors that grow along nerves. These tumors can vary in size and number, and while they are generally non-cancerous, they can cause discomfort and other issues. These neurofibromas can be just under the skin or deeper in the body, affecting various organs and tissues. In some cases, they may require surgical removal if they cause significant problems. NF1 can also affect the eyes, sometimes causing Lish nodules, which are tiny bumps on the iris. These nodules are usually harmless, but can be a key diagnostic feature of NF1. In some cases, NF1 can even involve the central nervous system, leading to learning disabilities or other neurological problems. Children with NF1 may experience difficulties in school and require special educational support. NF2 is less common and mainly affects the nervous system. It occurs in about 1 in 25,000 people and is characterized by the development of tumors on the nerves responsible for hearing and balance. The hallmark of NF2 is the development of bilateral vestibular schwannomas. These tumors grow on the nerve that connects the ear to the brain, known as the vestibulocochlear nerve. These vestibular schwannomas can cause hearing loss, balance problems, and ringing in the ears, also known as tinnitus. Early diagnosis and management are crucial to prevent severe complications. Management of NF involves regular monitoring and a multidisciplinary approach. Genetic counseling can help families understand the risks and implications of the disorder. Regular MRI scans and other imaging tests are essential to monitor the growth of tumors and assess their impact on the body. Early intervention can help manage symptoms and improve quality of life. Physical therapy and other supportive treatments can also play a vital role in managing NF. These therapies can help maintain mobility, reduce pain, and improve overall well-being. In some cases, surgical intervention may be necessary to remove problematic tumors or address other complications. A personalized treatment plan is essential for each patient, considering their unique needs and circumstances. Support groups and counseling can provide emotional support and practical advice for individuals and families affected by NF. Connecting with others who understand the challenges can be incredibly beneficial. Ongoing research is crucial to better understand NF and develop new treatments. Advances in genetic research hold promise for more effective therapies and improved outcomes in the future. Living with NF can be challenging, but with the right support and management, individuals can lead fulfilling lives. Awareness and education are key to improving the lives of those affected by this condition. Next up is tuberous sclerosis complex, or TSC. This is a condition that affects multiple systems in the body, making it a complex and challenging disorder to manage. TSC is another genetic disorder that can affect many different organ systems. It is caused by mutations in either the TSC1 or TSC2 genes, which are responsible for regulating cell growth and division. One of the key features of TSC is the growth of non-cancerous tumors in the brain, kidneys, heart, lungs, and skin. These tumors can vary in size and number, and their presence can lead to a range of health issues depending on their location and size. Now, let's talk about some of the common signs of TSC. Recognizing these symptoms early can be crucial for managing the condition effectively. On the skin, you might see hypermelanotic macules, which are lighter patches of skin that look like ash leaf spots. These are often one of the first signs noticed in infants and young children. Facial angiofibromas, which are small red or skin-colored bumps on the face, are also common. These typically appear during childhood or adolescence and can increase in number over time. Inside the body, TSC can cause cortical tubers, which are abnormal areas in the brain's cortex. These tubers can disrupt normal brain function and are often associated with neurological symptoms. These can lead to seizures, developmental delays, and behavioral problems. Seizures are one of the most common neurological symptoms of TSC and can vary in type and severity. TSC can also affect the kidneys, causing benign tumors called angiomyolipomas. These tumors can sometimes lead to complications such as bleeding or impaired kidney function, making regular monitoring essential. Additionally, TSC can impact the heart and lungs. In the heart, rhabdomyomas, which are benign tumors, can develop and may cause issues with heart rhythm or function. In the lungs, lymphangioliomyomatosis, LAMP, can occur, particularly in women, leading to breathing difficulties and other respiratory problems. Managing TSC often requires a multidisciplinary approach involving specialists from various fields to address the wide range of symptoms and complications. Genetic counseling can also be an important part of care, helping families understand the inheritance patterns and risks associated with TSC. Support groups and patient organizations can provide valuable resources and community support for those affected by TSC. With ongoing research and advancements in treatment, there is hope for better management and improved quality of life for individuals with TSC. Sturge-Weber syndrome, or SIWS, is a rare disorder that primarily affects the skin and brain. It's present at birth and is characterized by a distinct port wine stain, which is a birthmark caused by an overabundance of blood vessels in the skin. This port wine stain typically appears on the face, often covering one side of the forehead and upper eyelid. Now, the same kind of vascular malformation that causes the port wine stain can also affect the brain. In SWS, there's often a leptomeningeal angioma, which is an abnormal collection of blood vessels on the surface of the brain. This angioma can cause seizures, weakness on one side of the body, and even intellectual disabilities. Now let's talk about von Hippel-Lindau disease, or VHL. This is a rare genetic disorder that increases the risk of developing certain types of tumors. The most common tumors in VHL are hemangioblastomas, which can grow in the brain, spinal cord, and retina of the eye. These tumors are usually benign, but they can cause serious problems depending on their size and location. For example, a hemangioblastoma in the brain can cause headaches, seizures, and balance problems. In the retina, it can lead to vision loss. VHL can also cause cysts to grow in the kidneys and pancreas. While these cysts are often benign, they can sometimes become cancerous. That's why regular monitoring is so important for people with VHL. Ataxia telangiectasia, or AT, is another complex disorder we need to discuss. This condition is not only rare but also presents a multitude of challenges for those affected. It's a rare genetic condition that affects the nervous system, immune system, and other parts of the body. The impact of AT is profound, often leading to a significant reduction in quality of life. AT is caused by a mutation in a gene that helps repair damaged DNA. This gene, known as ATM, plays a crucial role in maintaining the integrity of our genetic information. One of the most noticeable signs of AT is ataxia, which is a lack of muscle coordination. This symptom often becomes apparent in early childhood and progressively worsens over time. Children with AT often have difficulty walking, speaking, and controlling their eye movements. These challenges can make daily activities and communication particularly difficult. Another hallmark of AT is telangiectasia, which are tiny clusters of blood vessels that appear as red marks on the skin. These marks are not just cosmetic, but can also indicate underlying vascular issues. These are most commonly seen on the whites of the eyes, but they can also appear on the ears, face, and neck. The presence of telangiectasia can be distressing for both patients and their families. AT also weakens the immune system, making individuals more susceptible to infections. This immunodeficiency means that even common illnesses can become serious threats, requiring vigilant medical care and frequent monitoring. Managing AT involves a multidisciplinary approach, including regular checkups, physical therapy, and sometimes medications to manage symptoms. Families often work closely with a team of specialists to provide the best care possible. Research is ongoing to find better treatments and hopefully a cure for AT. Scientists are exploring various avenues, including gene therapy and advanced drug treatments, to improve the lives of those affected by this challenging disorder. Support groups and communities also play a vital role in helping families cope with the emotional and practical challenges of AT. Sharing experiences and resources can provide much-needed comfort and hope. Despite the difficulties, many children with AT lead fulfilling lives, surrounded by the love and support of their families and communities. Their resilience and spirit are truly inspiring. Last but not least, let's explore Peutz-Jeghers syndrome. This rare genetic disorder is characterized by the growth of polyps, which are small growths in the digestive tract. These polyps can cause abdominal pain, bleeding, and even bowel obstructions. Another key feature of Peutz-Jeghers syndrome is mucocutaneous pigmentation. These are dark blue or brown freckles that appear on the lips, inside the mouth, and around the eyes and nostrils. While these freckles are harmless, they can be a telltale sign of the disorder. People with Peutz-Jeghers syndrome have an increased risk of developing certain types of cancer, including cancers of the digestive tract, pancreas, ovaries, and testicles. Thank you for joining us in exploring the complex world of phacomatoses. As you've learned, these conditions can manifest in a variety of ways, affecting different organ systems and leading to unique challenges for patients. Early diagnosis and multidisciplinary care are key to managing these conditions effectively. If you suspect you or a loved one may have a phacomatosis, it's essential to consult with a healthcare professional for proper evaluation and treatment. Stay informed and take care. Remember, knowledge is power when it comes to managing your health.